Today, we're going to talk about the importance of family involvement for children with autism spectrum disorder, or ASD. It is important for families to work with educators, organizations, and each other. As educational assistants, we find working with families to be an important part of a child's development. These are a few of many points which show why it is important to work with families. Positive outcomes, lifelong involvement, easier transitions.
Together, we talked to a few parents with children who have ASD, and from all the interviews, we highlight some of the responses that stood out to us. Parents get support through various online support groups and also meeting other parents who are in a similar situation. In one example, Katherine stated that she found that both time and visual schedules worked well with her child's routine. Katherine also stated that she believed the parent and staff roles should work side by side and find a way to communicate with each other efficiently. Nida also explained that she receives great support from her family and friends, but there are still individuals who are in denial and believe that she is exaggerating the difficulty that she faces with her child. When we asked if there's anything you want others to know about raising a child with ASD, it was shared that I am just like them, human. I'm tired. Please be careful with your words. My child will not grow out of it. Don't blame my child's meltdown on my parenting. For our interview, a sibling and a mother of a child with autism explained their perspective of their journey for the past 25 years. So when did you notice that there was a change in Joseph? At what age?
Well, he was about 2 years old, and just noticed that he wasn't talking or walking, and when I would call his name, he'll be like in a daze, or like in his own little world.
What do you think about the word disability or autism back then before you had Joseph?
Didn't really know much about it. It was difficult to, try to understand it and try to get the proper help for my son. Joseph was originally diagnosed with global developmental delay. He's always had a very high behavioral issue. It's recently, probably about 2 years or so, he was diagnosed officially with autism spectrum disorder.
Okay, so he was diagnosed with global developmental delay when he was 2?
That's correct.
And then, so now he's 25, and he just recently, when he was 23, got diagnosed with autism.
Yes.
Did you think he had autism?
I personally think he did. When Joseph was born, I really did not have access to a computer and resources, but when I did bring him to his psychologist, I did mention to her that when I would have him in public or gone to a family function and there was loud noises, I would have to remove Joseph from the room. He was very sensitive to noise. She asked if he would be, smelling things and smelling his hands, but, he wasn't doing any of that. She said, no, he did not have autism. Recently down at CAMH, that he was diagnosed with autism. Joseph was always put into a regular school, but was identified at the board with an individualized education program.
How was school for him?
Difficult. Again, what was more challenging for Joseph was his behavior would get aggressive, and because he was not able to express himself, he will express himself physically.
Did he get sent home a lot?
Yes, that would like suspend him from school, but it wasn't affecting his support. They did not have the proper resources to deal with his aggression. They had like an educational assistant to the point that they had to get an educational intervention.
Yeah.
They have different techniques to deal with behavioral.
Do you think that affected me in school?
I would say yes.
I think it did, because a lot of the times, in my experience, being the sibling, they called me to help with him. So they took away me from learning to help with him because they didn't know what to do.
We also wanted to look at an educator's point of view as well. In our research, we found that two-way communication between educators and families is crucial. As a future educator, we've learned that it's also imperative to focus on positive attributes and not only the challenges. In this next video, we interviewed Yolanda Esposito, a vice principal at Halton Catholic District School Board, on her thoughts on the importance of collaborating with families with a child with ASD.
Hi, I'm Yolanda Esposito, and I've been a vice principal for the Halton Catholic District School Board now for about 18 years. I've worked with all kinds of different children in the elementary panel, lots of special needs children as well. And not only am I in that role, but I'm also a parent of 4 children, of which 2 have autism. And so in my role, the most important thing is to collaborate with parents, particularly those that have children with special needs. The most important thing is to build that trusting relationship with these parents right off the bat. They need to know that whatever we do at the school, that their child's success is at the center of everything and every decision that we make. And we all want our children to grow up to be independent, to be resourceful, to be able to navigate their own community, to have friends, a social circle, and be independent in life. And so even if you have a child with autism, you want that same goal, that same outcome for that child. In the school setting, we aim to program accordingly so that we can fulfill those goals. And the most important thing is to work together with the parents, also with our paraprofessionals. So we do work with agencies collaboratively that work with the child. We also work with our educational assistants, our resource teachers, and the teachers in the classroom and within the school. Our particular board, we have embraced ABA methodologies, and all of our staff have been trained on those ABA methodologies, and we share those also with parents. It's a good thing to be able to share what we're doing in the school so that the children can generalize their skills in whatever environment they go into. Sometimes challenges come about throughout the year, and it's important to get together as a team and work collaboratively together to come up with solutions. I remember one situation where a boy with autism was very, very anxious about going on his first camping overnight trip. We arranged a meeting to be able to talk about all of his concerns, to be able to listen to what the concerns were from the parents and from him, and then address each and every single one of the concerns. We ended up having him connect with one of the counselors that actually worked at the campsite, but was going to be one of the supervisors going on the trip with him. We invited the counselor to the school to spend a couple of hours with him, develop a relationship, and he ended up having the most amazing time. The difficulty in collaborating sometimes with parents comes when the parents and the school don't necessarily have the same understanding of what the goals are. It's difficult for parents to maybe accept some of the challenges that their child is facing. It's difficult to have those difficult conversations about how we're going to problem solve through that. And so sometimes it's difficult to get them to the table to have those discussions. once you pass that, once everybody gets to the table, then you're able to problem solve. But when the parents sometimes don't want to hear maybe the reality or the truth of what is happening in the school, or they don't want to face some of those difficult decisions, that makes it very challenging on the school's end to continue to work with the parent. We don't obviously quit, but it does make it a little bit more challenging to problem solve and to program. I think the most important thing when you're meeting with parents is that you ensure that the parent knows what you know the child is successful at doing within the school setting. The parent needs to know that we recognize the child's strengths and that we use those strengths to work on the needs of the child. I think from a parental perspective, if I walked into a meeting and it was all about behavior and the negatives that are happening and there's no positive being said about my child, that would not leave a very trusting or a very good sense with regards to where we're at. I think we all have to recognize that every child is gifted in their own way. They all have different strengths and different talents and gifts. And we have to recognize those right off the bat when we first start that meeting, and then use those particular gifts to help us to create a program that's going to help them to meet some of the goals that we have established for them. To me, in my role as a vice principal in the school, it's been incredibly rewarding to be working with parents of special needs students, and it makes me feel very good when I'm able to support the child in helping them to become independent young human beings in the world today.
Parents of children with a diagnosis of autism play an important role in their lives. They are the first ones in recognize there is a developmental problem, and they are the ones who work hard to get the services the children deserve. During the development of treatment programs, parents are active partners in the process to ensure the skills they are learning in centers are transferred in natural environments, and they keep working on teaching skills that can only be learned at home and community. In the next video, Paola Egusquiza, Clinical Coordinator of Hope Autism Services, will be talking about the benefits and possible outcomes of parent involvement in therapy treatment in kids with ASD.
Hi, my name is Paola Egusquiza. I'm the Clinical Coordinator at Hope Autism Services. This is a center for treatment and development for children with autism. We have constant meeting with parents. There is direct observation, a clinical assessment, and most importantly, parent coaching sessions are offered to parents. The importance of the parent coaching is because we encourage parents to continue on with the strategies that the child learns here at the center. It's important for parents to be willing to learn the strategies that are applicable at home based on the skills that the child learns here at the center, depending on their intervention plan. Once the skills are mastered here, the child is able to perform those skills independently. We involve the parents and teach them how to implement those strategies at home so the skill can be transferred and generalized in a different environment. The importance of the parent coaching is one, consistency, generalization of the skill, and to teach a child how to transfer the skill learned in a different environment. Home is one of them, school is another one. To try to teach the right way, there's a procedure we use here, it's called error correction, and we encourage parents to be precise and be concise when they deliver instructions to their children. Tons of reinforcement is also something that we try to coach parents as to when it's important to reinforce a child, what are the behaviors that parents should be reinforcing. The negative side of the parent coaching, and it's not so negative, it's more so life is very busy, and at times it's very difficult for parents to follow through with what we are teaching here. We try to encourage them to do it to the best of their ability. If parents are willing to do it, they will take a little bit of time. They can set aside a time during the day or at night time before the child's going to go to bed, and just dedicate about 20-25 minutes of alone time, and give the child that one-on-one that they need. It's beneficial for the child. It's a continuity from what we're working on here. More than anything, is consistency. Is so important that the parents also teach. Once we deliver and we provide the intervention plan to the parents, every domain that we teach and every skill that we're going to teach do have a section that talks about parent coaching. Three components we use for the parent coaching are video sessions. We have the parents coming to observe, or we have the actual session that happens at home when we go and we coach the parents as to how they can transfer those skills that are learned here in a one-on-one setting at home. So hopefully, if you guys are able to communicate these to parents, encourage parents to be as involved as they can within their intervention or with the intervention plan, their kids' intervention if they're part of the therapy. It's very important that following through, having any visual aids if possible. There are different tools parents can use at home, visual schedules, person them boards, or token economy systems are tools that parents can use if they're teaching different abilities or different skills. If a child is involved in an intervention plan or receives therapy, having the parents involved, coming into the therapy, looking or observing the session, having videos, having the therapist coming to the house are things that are important too. I think it's crucial that parents do take part of the intervention plan, just to keep that consistency so everybody's on the same page. Like I said before, things are transferable, so that the skills that are learned in a one-on-one environment are learned at home. Also, they're transferred to school, so the communication always has to be open across all the environments and all the teaching environments where the child gets brought
It is crucial for families to have support from organizations, educators, and support groups when it comes to raising a child with ASD.